Hello, welcome to my presentation. Before I start, let me introduce myself. I am Luthfia Dea Savira. I am a student from Nutrition Department of Health Polytechnic Semarang. Okay, the topic that I want to share with you is about the test diet for hypertension. What is hypertension? Blood pressure is the force exerted by circulating blood against the wall of the body's arteries, the major blood vessels in the body. Hypertension is when blood pressure is too high. Blood pressure is written as two numbers. The first is systolic number, represents the pressure in blood vessels when the heart contracts or beats. The second is diastolic number, represents the pressure in the vessel when the heart rests between beats. Hypertension is diagnosed if when it is measured on 2 different days. The systolic blood pressure readings on both days is more than 140 mm of mercury, and the diastolic blood pressure readings on both days is more than 90 mm of mercury. The DASH diet emphasizes fruits, vegetables, and low-fat dairy foods with reduced intake saturated fats, total fat, and cholesterol. The DASH diet included whole grains, poultry, fish, and nuts, and was reduced in red meat, sweets, and sugar containing. The next is DASH diet history. Dietary approaches to stop hypertension or DASH diet originated in the 1990s. In 1992, the National Institute of Health started funding several research projects to see if specific dietary interventions were useful in treating hypertension. Subjects included in the study were advised to follow just the dietary intervention and not include any other lifestyle modifications to avoid confounding factors. They found that only the dietary intervention alone could decrease systolic blood pressure by about 6 to 11 mm of mercury. This effect was seen both in hypertensive as well as normotensive people. Based on these results, in some instances, this has been advocated as the first-line pharmacologic therapy along with lifestyle modifications. DASH diet effects. Consuming a healthful diet is an important approach to lower blood pressure or BP. This was shown definitively in the DASH trial, which demonstrated that consuming a diet rich in fruits, vegetables, and low-fat dairy products and reduced in saturated fat and cholesterol lowered systolic blood pressure or SPP and diastolic blood pressure DPP. The DASH sodium trial confirmed that the DASH diet lowered SPP and DPP. This is the DASH pyramid. First is vegetables and fruit. Vegetables and fruit is 4 to 5 servings per day. Vegetables are without a doubt the most vitamin and mineral packed foods you can find. Fresh and frozen vegetables are usually the best choices. But if you buy canned vegetables, look for lower sodium products. One trick to upping your vegetable intake is to fill up a half of your plate with vegetables for each meal. Almost all vegetables are DASH friendly. Some examples include carrots, broccoli, greens, green beans, Brussels sprouts, and celery. Fruit is great because it can be eaten with almost every meal. It tastes great and can even be a healthy alternative for dessert. Plus, most fruit is packed with fiber and other important nutrients like vitamin C. If you drink fruit juice, make sure to buy the kind without added sugar. You'll also want to leave edible peels on fruits like apples, pears, and peaches. The next is grain. Grain is 7 to 8 servings per day. Have at least 3 of grain servings to be whole grains. Examples of whole grains include brown rice, whole wheat pasta, whole wheat bread, and oatmeal. Whole grains, which are considered complex carbs, are better than simple carbs because they have more fiber and nutrition. Dairy. Dairy is 2 to 3 servings per day. Dairy products are the best source of calcium, an important nutrition for everyone. The key is to choose dairy products low in saturated fats, which means cutting back on foods like heavy cream, certain cheeses, and ice cream. If you are lactose intolerant, choose lactose-free dairy products, or you can take lactose supplements. Some examples of healthy dairy products include Greek yogurt, milk, and part skim cheese. Meat, fish, and poultry. 2 or fewer servings per day. Compared to other diets, the DASH diet doesn't cover a lot of meat. Eating lean meat in moderation is beneficial because they are rich in B vitamins, iron, zinc, and of course proteins. Fish is also high in omega-3 fatty acids, which can help lower your bad cholesterol. Some examples of DASH-friendly meat, fish, and poultry include salmon, tuna, and chicken. Oils and other fats. 2 to 3 servings of healthy fats per day focus on healthy fats like coconut oil, olive oil, avocado, salmon, and nuts. Eating the right amount of good fats helps absorb fat-soluble nutrition, but eating too much can cause to gain weight. For the DASH diet, try to limit fats to less than 30% of daily calorie intake. Avoid trans and saturated fats, which can lead to heart disease. Examples of these fats include butter, red meat, and cream. Conclusion. The combination of low sodium intake and the DASH diet was associated with substantially greater reduction in SBP among participants with a higher SBP at baseline compared with the combination of high sodium intake and the control diet. These findings reaffirm the importance of lifestyle interventions among adults with uncontrolled SBP. Further research is needed to determine the magnitude of SBP reduction that might be achieved in persons with SBP more than 160 mm of mercury, and in other conditions, including chronic kidney disease and congestive heart failure. The next slide is enhancing healthcare team outcomes. The DASH diet is nutritionally best approach to prevent and control hypertension. The diet has been tested in several clinical trials and has been shown to lower cholesterol, saturated fats, and blood pressure. The DASH diet has been recommended as the best diet to help people who want to lose weight, maintain a healthy weight, and lower the blood pressure. The key fact that this diet needs to be promoted to the patients. Besides clinicians, both nurses and pharmacists play a key role in educating patients about the benefits of this diet. Before discharge, nurses are in a prime position to educate all patients and their families about the DASH diet and its benefits. Similarly, when patients visit a pharmacy, the pharmacist should educate the patient about the DASH diet. The most important feature about the DASH diet is that it requires a lifestyle change and adopt a healthy way to eat. In addition, patients should be urged to stop smoking, abstain from alcohol, and do some physical activity regularly. Implementation of the DASH diet should occur under the guidance of an interprofessional healthcare team that includes clinicians, middle-level practitioners, nurses, pharmacists, and dietitians. This will drive optimal patient outcomes from using this diet. The outcome. The DASH diet has been well studied in many clinical trials, and most of them have been associated with lowering blood pressure. Further, there is evidence to show that the DASH diet also lowers the risk of adverse cardiac events, stroke, type 2 diabetes, and obesity. Unfortunately, compliance with the diet remains low. Outside of clinical trials, there are limited studies on the long-term effectiveness of the diet test. I think that's all from me. Thank you so much for your time and attention.